Sometimes, a normal day can take a sudden and scary turn. This is the story of Amara. She's a bright, active student, but today, something feels very wrong. Come with me as we turn the spotlight on Amara, whose day started as it normally does, but she didn't know she is in for an unexpected twist. Welcome to Gig Nurse Channel. Please subscribe to the channel, like, comment and share this video. I hope you enjoy it.
Amara, you look a bit off. Everything alright? You were so full of energy this morning, and excited about your volleyball practice.
I don't know, Chitty. I just started feeling weird. I am a bit hot, like a fever coming on. And my head is throbbing.
Did you eat properly this afternoon? Maybe the sun was too much for you. Here, have some water and these ground nuts.
Thanks. I had jollof rice for lunch, like always. It's just this sudden feeling. My muscles ache too, like I ran a marathon, but I haven't done anything strenuous.
The early symptoms of toxic shock syndrome can often be mistaken for something less serious, like a bad flu or malaria. But the onset is usually very sudden and severe. Let us see what happens in a few hours.
Amara, how are you feeling now? Is the fever any better?
No, it feels even higher. And now my skin feels strange. Like it's really hot and a bit itchy.
Itchy? Can I take a look? Your skin does look a bit red. Like you've been out in the sun for too long, but you haven't been.
The rash is a critical symptom of toxic shock syndrome. It often appears like a severe sunburn and can be a sign that the body is reacting to the toxins released by the bacteria.
It feels like a bad sunburn, but all over. And I'm so dizzy now, Chitty, when I try to stand up, the room spins.
This doesn't seem like just the flu anymore. The high fever, the muscle aches, and now this rash and dizziness. Something isn't right. Have you been using tampons recently?
Yes, why?
I remember reading something a while ago about a rare illness linked to it. It's called toxic shock syndrome. The symptoms. Some of them sound similar to what you're describing.
Toxic shock syndrome? I've never heard of it. What is it?
It's a serious illness caused by bacteria. It can happen if certain bacteria multiply and release toxins into the body. I think it's sometimes associated with tampon use, especially if they are left in for too long.
This is a crucial moment. Recognizing a potential link is vital for a quick diagnosis. Toxic shock syndrome is a rare but life-threatening condition caused by bacteria, most commonly Staphylococcus aureus or Streptococcus pyogenes.
Oh, I did forget to change it as often as I usually do today, with feeling so unwell suddenly.
Amara, we need to go to the hospital right away. These symptoms, especially the high fever, rash, and dizziness, along with a possible link to, well, it's serious. We can't wait to see Mama Fatima tomorrow. Just a little longer, Amara. They will see you soon. How are you feeling now?
Still so weak and dizzy. And my heart is racing. This rash. It's really bothering me now.
Time is of the essence. Getting to a hospital quickly allows doctors to provide the immediate care needed to fight the infection.
What if it is toxic shock syndrome? Is it very dangerous?
It can be serious if not treated quickly, but that's why we're here. The doctors here will have treatments, like antibiotics, that can help fight the infection. The important thing is that we recognized something wasn't right and came to the hospital.
I should have been more careful about changing my tampon.
Don't blame yourself, Amara. These things can happen. And remember, toxic shock syndrome isn't only linked to tampons. It can also happen with other types of infections. The important thing now is to focus on getting better. Come on, let's go. I can hear the nurse calling your name, so it is time to see the doctor. Based on your symptoms, the high fever, the sunburn-like rash, the low blood pressure, the muscle aches, and the sudden onset, along with the information about tampon use, toxic shock syndrome is a strong possibility. We've taken some blood and urine samples to confirm, but we're going to start you on antibiotics immediately.
Thank you, doctor.
Toxic shock syndrome can affect anyone. About half the cases of toxic shock syndrome linked to staph bacteria happen to people who menstruate. Strep toxic shock syndrome happens to people of all ages. Toxic shock syndrome has been linked to having cuts or burns on the skin, having had recent surgery, using birth control sponges, diaphragms, extra strength tampons or menstrual cups, and leaving them in for a long time, and having a viral infection, such as the flu or chickenpox. Also note that toxic shock syndrome can progress rapidly. Complications may include shock, kidney failure, also called renal failure, damage to other organs, such as hearts and livers, and death.
So what can one do to prevent toxic shock syndrome?
For tampon use, it's crucial to change them frequently, at least every 4 to 8 hours, and to use the lowest absorbency needed. It's also important to practice good hygiene, like washing your hands before and after inserting or removing a tampon. However, as your brother mentioned, TSS can also be associated with other skin or wound infections. So, maintaining good hygiene in general is important. Be aware of the symptoms, and if they develop, seek medical attention quickly, as you did.
Doctors need to act quickly. The first line of treatment is powerful antibiotics to kill the bacteria and prevent the spread of toxins. With prompt treatment, most people recover fully. Amara's story shows us how important it is to be aware of our bodies and to trust our instincts when something feels wrong. Knowing the signs of toxic shock syndrome can make all the difference.
You see? We did the right thing. You're in good hands now.
Thank you, Chitty, for taking care of me.
Always, Amara. Always. Now, just rest.
I hope you enjoyed this episode. Subscribe to the channel, leave a comment and share this video so that others can learn. You can also drop suggestions of topics you want us to talk about. See you on the next episode.